Hi everybody, it's Haylie from Warman Physio, and I am joining you on Cravings Live Instagram right now for a little question and answer on pelvic health in general. Hello. Basically, I want to give people a little bit of a chance to kind of join us and give you a little bit of a background about myself and what this question and answer is all about. We did get some questions from Jordana had questions after Kathleen's live last week on Monday about her pelvic organ prolapse, and she's now due with her second. So we thought that I would come on and answer some of those questions for everyone. If you do have questions about pelvic health in general as I'm going, feel free to toss them in the comments, and if I can get to them, I most certainly will. If I'm unable to get to them, I will do my best to answer them throughout the week as well. And if people have questions, hello Britt, if people have questions that they would like to have answered after the live, if you don't catch me on live, feel free to send Cravings a message and we will do our best to get whatever answers we can to you as quickly as possible. So I'm Haylie from Warman Physiotherapy and Wellness. On Instagram we're at Warman Physio, and then we also have a Facebook page, and I have been doing pelvic floor and women's health physiotherapy since I graduated in 2011, and I have taken countless numbers of courses at this point over the last 7 years, and my main focus in practice right now is working with women who are pregnant and postpartum, as well as doing pediatric pelvic floor. So my coursework includes doing my entry-level 1 women's health coursework, which means that you can then work with women who are experiencing incontinence and pelvic organ prolapse. And then I've also done level 2, which relates to pelvic pain, an anorectal course, so working with bowel function as well, and pediatric pelvic floor through Eurosante, and going from there. Hi Kristen, hi Kristen, and Carmen. I'm gonna try and say hi to people as they join, but I'm probably gonna end up forgetting to check. So yeah, I've done several courses and I practice extensively with the perinatal population as well. So if you do have questions about pelvic health as we go through, feel free, like I said, to toss them in the comments and I will do my best to get to them. In the meantime, what I'm going to do is I'm going to go through some of the questions that we have had from Kathleen's on last Monday, the live that she did on last Monday as well. So hello. First question is 6 weeks a magical number to get back to working out? So I find, or we find in society, a lot of times people will be told at their 6-week follow-up with their physician that they're good to go and just to go back to doing exercise the way that they were before. And that's not always the case. So from a medical perspective, what we're looking at is there any further risk of infection? Are there other complications that are going on that will prevent you from returning to exercise? And those like major medical problems. When you come to a pelvic floor physiotherapist, we're going to take a look at a different set of criteria to determine what might be maybe a little bit better to get started with versus not. So we want everybody to be able to get back to exercise when they want. Just keeping in mind that that first 6 weeks is our really important healing time. You do want to actually take some time to rest and do some gentle movement, but rest is quite important. And then at that 6 to 8 weeks postpartum, generally what we are looking at is what is that tissue doing in through pelvic floor? How are the joints moving through the pelvis and the hips, just to make sure that everything is coordinating well. We'll check out the abdomen for diastasis recti and ensure that everything is coordinating well together, to ensure that when you do start back to exercise that you're not necessarily making anything not improve the way that it could otherwise. So there are some factors that we'll consider that a physician won't consider that might change what kind of exercise we would recommend for getting started with, but we always like to work with our clients to also do exercise that you enjoy. If you don't like swimming, I don't think that we're going to send you swimming kind of idea. I personally like swimming, so I would love to go swimming instead and go from there. So although often we find that that 6-week mark is a gung-ho, get back into exercise, it's not necessarily going to be that case for everyone. Now, if you don't have access to a pelvic floor physiotherapist, making sure that you're paying attention to what's going on throughout your body as well will be important. So in Kathleen's instance, she was talking about how when she got back into exercise, she just went hard and wanted to do all of the things at the gym that she had been doing before. And that can work for some people. In Kathleen's instance, she ended up feeling a lot of pressure and heaviness in through her pelvic floor as she developed a pelvic organ prolapse. And the pelvic organ prolapse is a downward descent of the pelvic organs, and it can happen to quite like several organs, but the 3 most common are your bladder, your uterus, and your rectum. So if you are feeling any symptoms, pelvic floor heaviness, feeling like things are falling down or falling out. A lot of people will describe feeling like they've always got a tampon sitting there, or if you're having any leaking or pain, are all indicating factors that maybe what you're doing is a little bit much for your current state. Not that it will be a little much forever, but for the current state of healing, okay? Hi everybody. Oh, I missed a whole bunch. Sorry about that. So the next question I have is, when should you seek help from a pelvic floor physiotherapist? I tend to stay away from should or should not, or is this the right time or the wrong time, because there really is no wrong time to see a pelvic floor physiotherapist. It's never too late. But if I had my choice for my postpartum mums, I would see you for pelvic floor physical therapy between that 6 to 8 weeks postpartum, because it gives us a chance to actually get in and take a look at what the pelvic floor is doing, as well as get you started on that path to more ease of movement and coordinating everything as well as possible without having already created a whole bunch of compensatory patterns. So if I could pick, I would see my postpartum mums at that 6 to 8 weeks and go from there. Now, if we're talking outside of the perinatal period, I kind of think that everybody should have a pelvic floor physiotherapist prior to labor and delivery as well. So we can see people during pregnancy. We don't do any pelvic floor exams in the first trimester, so long as people know that they're pregnant. Sometimes they don't. And so we don't aim to do any pelvic floor exams in the first trimester, but once we hit second trimester and on, we can do pelvic floor exams, and we should be able to address any presenting problems as they arise during pregnancy. So for people that aren't experiencing any issues during pregnancy, and they're getting ready for labor and delivery, we're in that 3rd trimester, we also do labor and delivery prep treatments as well, so assessment and treatment, generally between that 32 and 34 week mark, just to see how the pelvic floor is reacting and getting ready for labor and delivery, giving you some ideas of things that you can do to get prepped for labor and delivery. A lot of times we hear people given the information that you need to do 5,000 Kegels before labor and delivery, which is fine if you're contracting as well as relaxing the pelvic floor. People forget that when we're contracting the pelvic floor in a Kegel, that we actually then need to fully relax the pelvic floor in order for it to be a complete Kegel cycle, okay? So if we aren't relaxing that pelvic floor, our pelvic floor keeps things up and in, and as you're getting ready for labor and delivery, generally, not always, but generally the ultimate goal is for a baby to come down and out when possible. So being able to relax your pelvic floor is very important. Hi everybody who's joined me. If you do have any questions, feel free to try and pop them in the comments and I'll see if I can grab them as we go. So being able to relax the pelvic floor, if everybody wants to try this, you're kind of sitting tall with your feet planted on the floor. When you breathe in, your pelvic floor in theory will relax down and out a little bit. So if you do a Kegel, you'll feel the pelvic floor lifts up away from the chair. When you relax, it should all fall down towards the chair. And I always kind of imagine, you know, the toy claw machines that come down to pick up the toys that never pick up the toys, but I always kind of imagine that describe that while we're trying to practice that relax. If you can't appreciate the relaxation, it might just be that you don't have a whole lot of movement available, and that's okay, but that's one of the things that we're wanting to be able to accomplish, as well as that active relaxation of the pelvic floor, because if your pelvic floor can't relax, it'll make it a little bit tricky for baby to come down and out during labor. So that's another thing that we can do as a pelvic health therapist is work on that labor and delivery prep and getting things going. One of the things that I'll note too during pregnancy is that diastasis recti or diastasis recti or DRA, whatever you want to call it, is normal during pregnancy. It has to happen. So that's that splitting of the abdominal muscles that occurs during pregnancy. Anybody who has a belly, if you go to sit up and you get that little kind of tent or little cone on the middle of the belly, that's that DRA, and it's normal during pregnancy. So we won't be able to get rid of that during pregnancy or anything, and that's one of the areas that we can address postpartum as well. So let's move on to the next question. I kind of got off topic there a little bit, but that's okay. Do I have to stop working out if I have pelvic floor dysfunction, was one of the questions. I know that we do get this question quite frequently, and although pelvic floor dysfunction is a wide array of things that could be going on. So we're thinking about not only leaking, so leaking of urine or leaking of feces can occur. Leaking of urine, according to research, happens to about 30% of women postpartum, and then leaking of stool occurs in about 10% of postpartum women. And although it's common or not as common, it's definitely not a normal state of pelvic floor function. So leaking is not normal. Another pelvic floor dysfunction that we'll find is pain with intercourse. So if you have pain with intercourse, that's a pelvic floor dysfunction, as well as I often will find women will have tight hips. It feels like you just can't go quite as low in a squat as you could before, or maybe you've never been able to go very low in a squat. Tailbone pain is another possible indicating factor of pelvic floor dysfunction. And then there's been some research that indicates that non-specific low back pain can also be related to pelvic floor dysfunction. So 96% of people with non-specific low back pain also have pelvic floor dysfunction. And with that, I always tell people if they've got a back pain that they've seen quite a few people for, but it's never really seemed to get better, and they haven't done a pelvic floor exam, that pelvic floor exam may be one of the keys to resolving that back pain. So if you're experiencing leaking or heaviness of the pelvic floor during exercise in particular, or after exercise more specifically as well, it doesn't mean that you can't exercise. It just means that we might need to change a couple of things in how you're exercising, give you some different tools and strategies to be able to do what you want to do. Now, in some instances, we might be scaling back. So I've had some people come into the clinic and they are deadlifting or squatting over 100 pounds, but as they're doing that, they're having some leaking. And what we prefer to do is we prefer to scale back to a point where we're not leaking, and then manage that to a point where then you are lifting those heavier weights again and going from there. So leaking of the pelvic floor is not normal. Pressure, heaviness is not something that we want to be experiencing either, and going from there. So hi everybody who's joined. I think I see an Emily and maybe a Tegan. We'll go from there. So next question, what happens if I ignore my pelvic floor dysfunction and continue on while leaking? Will things get worse? So commonly speaking, most pelvic floor dysfunction, when it's not being addressed, will get progressively worse. For some people, it'll kind of get to a point and then it just stays at that particular point. But continuing to do what you're doing while leaking isn't going to make it better either. So if the leaking doesn't bother you, you don't have to come in. Dysfunction is all related to what you're willing to kind of tolerate as well. So there's some ladies that I talk to and they're like, well, I leak, but it's just a little bit and it doesn't really bother me. Do I have to come in? No, you don't have to see anybody if you don't want to. But I think that a lot of the not wanting to come in, if you have the means to come in, potentially comes from a fear of being told that you can't ever exercise again. And at our clinic at Warman Physio, that's not our goal. Our goal is to scale appropriately as needed for now and then be able to get back to doing things. So I had a client who was running and she was only able to run for 2 minutes before she started leaking, and she wanted to do all of these triathlons for whatever reason, not my thing, but that's her thing, so that's great. And she did her last triathlon last month, I want to say, and she was leak free. So we're able to address the concerns and then be able to get you back to doing the things that you want to do, so you don't have to worry about not being able to work out forever, that kind of thing. My goal and our goal at the clinic is to be able to keep people doing the things that they love, because being able to do the things that you love is really important for your mental health as well, and our mental health is really important as moms. So that's one of the things that we consider for that might be able to help people make the decision if you want to come or not want to come. So definitely, if you continue to do what you're doing without making any changes and it's not getting better, it's not going to be helping the situation necessarily. It may or may not make the situation worse. Commonly speaking, if you're doing workout stuff and you're finding that you can't progress beyond a particular weight, sometimes it's related to our core function, which includes pelvic floor and the abdomen and diaphragm. So those are all things that we can work on as well and go from there. So worse is one of those things that's hard to quantify. Maybe, maybe not. So our next question: when is an ab separation, that's that DRA I was talking about, something to be concerned about? So our diastasis recti, DRA, splitting of the abs, is something that we will work with as a pelvic floor physiotherapist or a pelvic health therapist in the postpartum phase. And Diane Lee and Associates have found that if you have a dysfunctional diastasis, or a diastasis that isn't transferring a load back and forth, at 8 weeks postpartum, if we don't do anything specific about it, that will continue at a year postpartum in over two-thirds for sure of people, if I'm remembering correctly. So being able to specifically do something about that dysfunctional diastasis is important. But what exactly is a dysfunctional diastasis? There are a lot of test yourself for diastasis videos and things like that on YouTube, and I find that they don't necessarily get to the heart of the problem. But basically what we're looking for is we're looking for that tissue in the center of the abdomen that feels like extra floppy, basically. So our bodies aren't meant to bounce back after labor and delivery. There's no snapping back. I don't know about you guys, I did not hear any snapping postpartum. And the ability for that tissue to then transfer load is what we're looking for. I know a lot of times, again, with those like self-assess videos, don't know about you, but most people don't go around palpating a DRA on a regular basis, which can make it really difficult to appreciate if you actually have one or not. Whereas us at the clinic, myself and Kendra in particular, we do this on a daily basis for the most part, so it makes it a little bit easier for us to appreciate what's going on there. So yeah. When is it something to be concerned about? If it's preventing you from being able to do things that you enjoy doing, if you're experiencing any kind of difficulty lifting kids, doing a workout that you want to do, and those kinds of things. So some stuff to watch for if your belly cones like it was during pregnancy, if you can't seem to keep it from puffing forward or really sucking in, that can be problematic as well. And often the DRA itself isn't painful. So if you have a DRA but you don't have any other pain or anything going on, sometimes it's just a coordination thing, and we can work on that with you as well. What else here? Would you recommend seeing a pelvic floor PT while pregnant? I already did that one. So yes, seeing a pelvic floor physio while pregnant can be beneficial. And one of the things, like especially if you're not experiencing any issues, if you come for one of those labor and delivery prep assessments, one of the things that I find is really helpful with that is that we will be able to show you what to do with the contract and the relax, and then you have that tool to be able to use basically immediately postpartum, so that you don't feel like you have to rush into the clinic. And we can give you lots of education as well as to, okay, what to be watching for postpartum, things to keep in mind, and go from there. So yes, seeing a pelvic floor physio prenatal can be helpful. If you're experiencing any symptoms prenatal as well, I always tell people that often if we have pain or leaking or something, it's, oh, well, just wait until after labor and delivery, it'll get better. Or, you know, you're pregnant, this is what you signed up for. But if you kind of flip that, and like, yes, most people have chosen to get pregnant and that was a goal of theirs, but if you have somebody who's chosen to run and they develop knee pain, what's the reaction that we have to a knee pain? It's, oh, well, maybe we should get that checked out and we should have it looked at. So let's apply that same principle to our prenatal and postpartum moms as well. If you have an issue, if you're having a dysfunction, let's just find the people who can address that. And as a pelvic floor physiotherapist, we are able to address leaking during pregnancy, and we are able to address many types of pain during pregnancy: back pain, tailbone pain, pubic pain, SI pain, sciatica, all those kinds of things. So you don't have to necessarily suffer with them for an extended period of time. Hi, Kathleen. Making sure that that we are able to actually enjoy our pregnancies is something that I feel very passionate about as well. Like, why should we have to suffer from possibly 12 weeks or earlier with pain that gets potentially progressively worse as pregnancy goes on? It just seems kind of silly to me, especially if there's a resource that we might be able to use that could potentially help as well. So the last question I have is, I have pelvic pain while pregnant, will physio help? And I just kind of did that one as well. So we can't ever guarantee that something will help because it depends on what all's going on. Pain is actually an experience. So we don't have pain as like the same way that we have an injury or a tissue injury. So pain is an experience of harm or potential harm to tissue, and then it's all kind of related to our beliefs around that. So in our society, we have lots of beliefs around, well, pregnancy is painful, and sometimes that expectation of being painful will lead us to become painful. And then when you think about it as well, during pregnancy, we have this rapid change in our center of gravity, just how our body is all shaped. There's all of the extra relaxin and everything just moves differently than it did before. So all of these changes, your brain, because it's being primed to, may interpret as something that would be painful. And then we have pain. And often the pains that we experience are related to a length and tension discrepancy. So the muscles themselves are tight on one side, or they're short kind of idea, or we have weakness as well in one set of muscles versus extra tension in a different set of muscles, which that imbalance can lead to pain as well. So I didn't think that I saw any questions come up. I'll try and scroll through here quickly. Other than that, I think that's going to be it for me for today. And like I said, I had told Jordana that I am happy to pop on again if I need to, or send messages. I can send Jordana the message answers if you guys have questions, if you're seeing this after the live is complete, and we can go from there. Does anybody have any questions that they want me to answer right now? can like toss them in there and go from there. So again, I'm Haylie from Warman Physio. You can find us at Warman Physio here on Instagram, and then we also have a Facebook page as well, and the Facebook page is Warman Physiotherapy and Wellness, and we have 2 locations, one in Warman, and then we're in our temporary room in Saskatoon, and then we hope to have our permanent room in January, so I'm really excited about that. Myself and Kendra at the clinic are the pelvic health therapists, and then Shannon, who is going on maternity leave in January, but she also does some orthopedic stuff, so can help us with the back pain, the pelvic pain, pubic pain as well. And then we also have 3 massage therapists. We've got Lauren and Chelsea and Sam that are in to help people. So we have daytime, evening, and weekend for massage. And then we have an occupational therapist who works with kids. Her name is Megan, and she has a pre-printing workshop today. And then we often do workshops on pain in pregnancy or back pain, sciatica, those kinds of things. You can tune in to our page to find those. And I just want to say a huge thank you to Jordana for allowing me to see and speak with all of you guys today. Hello. Hello, Christine. But I really am appreciative to Jordana for reaching out to me to work with her on this project, and Kathleen for joining us on Monday last week and telling her story and going from there. So I haven't seen any questions pop up. Hopefully I didn't miss them. I'll have Jordana double check for me. I'm not great at Instagram yet. And we'll go from there. So thanks everyone for joining me, and have a fabulous rest of your Monday.